Hi, welcome to PKR Vibes Career and Growth. Today we are discussing about the details, claim details, what claim details are required to submit the claim form CMS 1500 to the insurance. Generally we have patient details, insurance details, provider details, and service details. We have to fill all these details and we have to submit this form to the payer so that that claim will be processed and paid. So we have to discuss everything in details. To submit a claim to an insurance company, we need first one is patient details. In that patient details, we have to know what do you mean by patient name. We have to fill the patient name, we have to fill date of birth, we have to fill the address for that patient, and we have to fill the social security number, and we have to enter the patient phone number. So the name, date of birth, address, SSN, phone number are required, and these are comes under the patient details. We have to put these details under the patient blog. Coming to the next one, insurance details. So what do you mean by insurance details? Are nothing but what is the insurance name, what is that policy ID which is given to the patient as per that insurance company, and what is that insurance ID or otherwise payer ID to submit that claim, and what is that group number, and subscriber name, and subscriber is nothing but patient, and subscriber relationship. This every details are coming under the insurance details. And coming to the third one is the provider details. So provider, we should have to mention provider NPI. NPI stands for National Provider Identification, and the provider name, provider specialty, and address for that provider, group number, sorry, group NPI, group name along with that NPI, and the tax identification number. Everything should be provided for that provider and that claim form and provider blag. And coming to that fourth one, service details. So service details is nothing but what kind of service is given to the patient and that particular date, what are that date of service, and what when the date of service was done, and the place of service, where the place of service was done, and the CPT codes, what kind of CPT codes or ICPIC codes are done, and how the service was done. It was done by the modifiers, and diagnosis pointer are nothing but diagnosis code that describe about that disease, what was done to the patient, and the provider specialty. And so these are that main thing. And we should have to correction, the provider specialty not comes into that service details. The provider specialty is coming into only provider details, and sorry for that. So these are the main details on a claim form: patient details, insurance details, provider details, service details. This everything should be on a CMS 1500 form. So CMS stands for Centers for Medicare and Medicaid Services, and this is for physician billing. The CMS 1500 form is contain 33 fields, and this is for professional billing or physician billing, it will be called. So now we have to discuss about what do you mean by diagnosis code and procedure codes. So here first, diagnosis code is also known as ICD code. ICD is nothing but international classification of a disease, and diagnosis code here nothing but to describe the problems or health issues or injury. So what kind of disease you have, we should have to know with the help of alphanumeric form. It is called as a diagnosis code. So this diagnosis code is assigned by a World Health Organization, WHO. And example, I have some examples for the diagnosis code. If the diagnosis code is starting with the F F002 F99, in between if we have any diagnosis code which is followed by F, that is related to the mental or behavioral or psychological department. So we can analyze that if there is a diagnosis code starting with F and it is under 00299 number or numeric, then we can understand that it is related to the behavioral services. And coming to that S 002 S99, in between that we can find any diagnosis code which is followed by the S, we can find that it is related to the injury. Coming to the next one, G Z002 Z99. So this if you find any diagnosis code followed by the Z, then we have to find that okay, this is related to the routine service, so routine visits. So coming to the next K K002 K99, in between if you find anything, the diagnosis code followed by the K, it is related to the gastro. So gastro diseases, it is related to the gastro. Coming to the next one, R002 R99, in between if you find any diagnosis code followed by the R, it is related to the abdominal pains, unspecified abdominal pains. So these are the example for the diagnosis code, basic standard diagnosis code which are repeated in our healthcare. So these are diagnosis code is nothing but this is the details about your disease, or nothing but which is describe the injury, that is diagnosis code. So coming to CPT, CPT is also known as a procedure code. So here the procedure is nothing but the treatment whatever given to the patient is called as a procedure code. So CPT stands as a current procedure terminology. The CPT is assigned by a AMA. AMA is nothing but American Medical Association, and this is it to describe the treatment or procedure. Here we have to understand that AMA do changes every year, and ICPICs, these codes are assigned by a CMS. We should have to note this point. This is only ICPIC codes are to describe the non-medical services. It is not a medical services. And CMS do changes every quarter, every 4 months it will be changes. So here the coming to CPT. CPT is a 5-digit numeric codes. If CPT codes starting with 0, those called as a anesthesia codes. Anesthesia is nothing but making unconsciousness. So they are giving local anesthesia. It's nothing but they are giving that drug to our spinal bone. Coming to the next one is general anesthesia. So nothing but they are giving drug in the form of chloroform. So coming to the next one, 0 to 6, in between 0 to 6, if you find any codes, and I'm really sorry for that, it is not a 06, it is 1 to 6. So if you find any procedure code in between 1 to 6, it will be surgery codes. And coming to the next one, if there is a 7, if CPT code is nothing but 5 digit numeric codes. So if it is starting with the 7, it will be known as a radiology codes. So coming to the next one is a 8. If the CPT code starting with the number 8, then it will be called as a pathology or laboratory codes. It requires clear number. For 8 series code we required clear number. And coming to the 9, it will be called as a medications or medicine. And with the 9, if there any CPT code starting with 90, those will be called as a vaccine codes. The vaccine codes is nothing but if you get any disease, if they are giving, it will be called as a medicine. But if you are not getting any disease, before disease if you give any medicine, it will be called as a vaccine codes. This vaccine codes also known as a preventive codes. To prevent the disease, before we disease we required that medicine. So that CPT code starting with 90. For example, polio, that before disease we will get that vaccine. And recently for COVID-19 also we use vaccine codes. That codes will be starting with 90. We can find easily, okay, if there is a 90 starting series of CPT codes, then we can find it is a, okay, vaccine codes. Coming to the 93, it is a scan codes, for example duplex scan codes. And if any CPT start with 99, it's called as a evolution and management codes. So these are the CPT codes in our healthcare domain. We should have to concentrate all those things in clearly. And thank you for your time for watching this and letting know all that details. Thank you so much.